Well, hello everyone, and welcome to this week's business building session. I'm Mike O'Neill, and I'll be serving as your host today. And joining us today as expert panelists are Totem Solutions' Annette Griffin and Geoff Rowson. Annette, welcome.
Thank you. Good morning. I'm happy to be here.
We're glad you're here. And Geoff, good to have you with us well.
Thanks, Mike. Happy to be here too.
Also joining us again is my colleague, Rhonda Beard. Rhonda will be again sharing some important updates on the back half of our time together this afternoon. We launched these Q&A sessions about 3 months ago for really one purpose, and that is we were hearing from our clients questions that were really good questions. And as we were researching those answers, we felt maybe there are others who have the exact same question. We found that we also wanted to invite expert panelists to join us to get those fresh perspectives. And so I think you're going to enjoy hearing from both Annette and Geoff this morning. It looks like about half of you who have registered for this webinar are new to us, and we welcome you. But let me give you a little bit of feel for what we're going to be doing in our time together. We're going to have two parts in our time together. The first part is we're going to hear from our expert panelists, Annette and Geoff, and then we're going to move to Rhonda, who will provide some important updates. But what you're going to find, and I'm going to switch the screen so you all have got that, is what we would be doing is following the webinar, as many of you are kind of accustomed, is you'll be provided with a link to the recording. That recording captures everything that we're discussing today. You'll also be getting a link to the slide deck that we are using. And there'll be some other information that I hope you'll find helpful. The nature of this approach we're taking is we'd love to hear from you. We'd love to hear your questions. And what makes this work and work well are your questions. We want to hear your questions. So as you're hearing from our panelists, if you got questions, let us know about them, put them in the chat box, and we're going to try to get to those questions while we're together this morning. The folks I've invited to join us this morning are folks that I think you're going to enjoy hearing from. I actually got a chance to listen in on their webinar last month, and it kind of opened my eyes to the fact that, as you probably know, Rhonda and I come from an HR background, and as such, we were managing employer-sponsored health plans. And my friends here at Totem introduced me to some things that I think you're going to find interesting. I hope that will be the case. But what we invited them to join us to do today on is to speak on this notion of why are employer-sponsored, why is that healthcare approach broken, and what are they doing to fix it? And that's pretty much what we're going to be doing today. And if you don't mind, what I'm going to do is jump right in. Annette, if you don't mind, just let us know a little bit about Annette. Tell us about Annette. What do you do for Totem, and maybe a quick overview of what Totem does?
Sure. So I've been with the Totem team for about 15 years, have about 20 years of experience with health plans specifically, and I'm in sales, and I also am an account executive, and we think outside the box for our customers. We're a benefits consulting firm, but we do much more than benefits consulting. We have a very high touch service model with employees. Our services are very highly specialized and not offered by many other consultants, so we consider ourselves a boutique firm, and everything we do today is really as a result of a very specific customer challenge. So we have the ability to do things like outbound new hire orientations, text messaging for employees, which has been highly effective for engagement. We handle all aspects of benefits administration and really that service benefits education for employees and their families.
Annette, that's a great overview. Thank you. Geoff, can you tag along? Tell me what you do for Totem, please.
Good morning. Again, I'm Geoff Rowson. I've been with Totem for about 8 years and really in the industry since graduating in 2008 in healthcare in general. I love what we do. It's exciting. You know, most days it feels like a decathlon because we're touching so many different disciplines. But at the end of the day, you know, we're focused on helping people, helping our clients solve complex problems, helping them shine for their peers, and then helping their employees navigate the difficult world, which we call healthcare. And you know, that's fulfilling, and we enjoy doing it. In terms of my time, I'd say it's pretty evenly distributed between finding what we think are the most innovative solutions and evaluating them, to doing business development, telling people, you know, what we do and how we do it, and then service. And so we're unique. We have the luxury of being boutique in that we're not a kind of sell and hand off agency. We're really focused on quality over quantity.
Well, I appreciate that. Annette, I want to start with you. The questions that I'm going to be asking, these are the questions that I asked of them. We said this is kind of a Q&A session, and these actually are questions I posed to Annette and Geoff. But I want to start with that very first question that we would like to ask, and is, what is it about employer-sponsored healthcare today that's broken, Annette?
Sure. So we all know that there are some challenges with the healthcare system. We are all about improving the benefits for employees and reducing costs for employers. And really to do that, to change the trajectory of health insurance and health care, we have to acknowledge that there's three big problems with healthcare today. We call them the three villains. They're overutilization, quality, and cost. And many consumers and employees don't really realize, they don't know what they don't know. So they don't realize, of course, everyone knows about the price issue, but the overutilization issue and the quality issue, many employees are not aware of this. And that's one of the biggest changes I think that's happened over the last several years. A lot of this data is becoming more and more available. And so our solution is really focused on making that data usable and making an impact on healthcare. So when we talk about overutilization, there's 30% waste and misdiagnosis in the industry. That's a general statistic. For misdiagnosis, it goes actually up to 67%, depending on the type of procedure or condition. And if we look at, for example, if we look at Walmart, they have over 1 million members on their health plan, and they have a Centers of Excellence program. And the results of their Centers of Excellence program are a great demonstration of this problem, both with utilization and with quality. So a Centers of Excellence program, the employee pays $0 at these designated centers around the country. It's a very nice benefit. They get to go to this facility they normally wouldn't have access to. It's a panel approach. They're paid on salary. The physicians are paid on salary. So of the employees that went to a Centers of Excellence program for orthopedic surgery, 50% of them did not need the surgery. In terms of joint surgery, it was 20%, unnecessary surgeries. So had they stayed local and they would have received that surgery, it would have just contributed into this healthcare waste. In terms of cancer, this is pretty telling. It was 55% of the associates that went to the Mayo Clinic for cancer treatment received a different treatment plan. And their misdiagnosis, Walmart's for cancer, was 10%. So they had employees being told that they had cancer, they didn't have cancer. In terms of quality, digging more into the quality, 1/3 of employees are seeing the top providers. So we want to change that. That's the goal of Simple Pay. That is our goal, to really improve the health. It starts all with finding a top quality provider. Physicians say that 21% of care is unnecessary. And in terms of quality, 100% of physicians surveyed know someone that shouldn't be practicing. So going back to that Walmart data with the Centers of Excellence, employees that had a surgery at the Center of Excellence, there was a 95% readmission, reduced rate for readmissions. So that's very significant. That's huge. And Walmart was also seeing return to work for those associates 3 weeks earlier. So again, demonstrating the quality issue. In terms of more kind of general Centers of Excellence data, The misdiagnosis rate for cancer overall is 30%. So, that's very telling. Some of this has to do with the growth of the PPO networks, and these large networks and insurance companies are under tremendous pressure to add doctors without consideration of quality. So let's talk about price. Before COVID started, we had a bad situation, and it's only gotten worse. Healthcare has increased more than any other business segment in the last 20 years, followed closely by the cost of college. Had healthcare tracked with inflation, U.S. Workers would have at least $5,000 to spend on other things. So the biggest takeaway for me here is that it's not just employees and employers that are being impacted, it's the whole economy with this healthcare. There's tremendous amount of cost variation within the PPO networks as well. So you have anywhere from 400 to 1,200% of Medicare as billed charges, so significant variation within that network. And then a few other statistics I think are really important to consider when we look at price. 60% of the workforce earns under $20 an hour, and the average family of 4 premiums per year is $20,000. You also have 50% of the households in the United States that have less than $1,000 in savings, and 50% of those households have a deductible over $1,000. So last, in terms of price, healthcare is really unlike any other shopping experience. We don't know what we're going to pay until after our procedure. We get different bills. So if I have a surgery, I get an anesthesiologist bill, a facility bill, physicians. Totally different experience versus going to the grocery store. It would be like me going to the grocery store and getting a different bill from the dairy and from the produce and from the meat department, completely different than any other shopping experience.
Annette, as you probably know, when we talked prior to this webinar, the folks who are tuning into this webinar and participating kind of fall into kind of 3 groups. These are business owners, these business. Geoff, I think both Ron and I come from an HR background, and that is in HR, we're always looking for ways to provide high quality service at the lowest cost. As bench builders, we try to do things such that everything we do has a bottom line impact. So as HR folks, we're always looking for ways to cut costs. Can you kind of elaborate, Geoff, on what are employers doing now to kind of solve problems? And I imagine the list is kind of long, but of all the things out there, can you kind of recap what's going on out there now?
Sure. And as I alluded to earlier, a big piece of what we do is looking at all the solutions that the marketplace has to offer. And there's a different solution set perhaps that's ideal for a different customer based on size and geography. But I would say the kind of overriding principle is that to implement any of these, you really kind of need to get away from what we call benefits in a box, dealing with one of these big carriers that really does everything. From your stop loss to the network, to the claims administration, to your wellness program, to your pharmacy, and really kind of break that down into the individual components. And so that's really step 1, is having that conversation. And then employers are looking at things that you may have heard of, maybe you haven't, going to an independent TPA where you have full control, putting in a transparent PBM where you're getting 100% of the rebates, which is really low-hanging fruit in this world because there's so much savings there. As Annette alluded to, centers of excellence to address your high-cost, complex procedures, direct contracting with local providers and hospitals, which could make sense based on your geography, putting in direct primary care, whether it's brick and mortar, on-site, or mainly virtual. And then doing some more transparent things with things like your specialty drug review and third-party utilization review. And then a big buzzword these past few years has been reference-based pricing. and there's tremendous savings there, but there's also a lot of disruption and a lot of work, and sometimes it's a fit, sometimes it's not. It really depends on where you are, kind of what the local hospital environment looks like. But through all that, what we've found is that what really matters and what really moves the needle is steerage to quality. And as Annette alluded to, 5-6 years ago, CMS started releasing the data on cost, quality, things like risk-adjusted readmission, mortality, infection rate, time, days in the hospital, procedure volume, by type, by provider, by facility. But it was, even though we had the data, it was really hard to get people to use it. All these companies like, Compass, for example, have all this data. They can, Mike, you can call in and they can tell you who the best quality, best cost provider is for a certain procedure. And the problem was that people just weren't using them because we've been ingrained to purchase healthcare through word of mouth, not by seeking, the actual quality information for the procedure that we're trying to get. And so that really is what led us to a solution called Simple Pay that we are very excited about. Really think it could be the future of healthcare, and we're excited to share more about that.
As I'm listening to both of you all describe the complexity of healthcare as an employer trying to manage all those moving parts, it can be a bit overwhelming. What I did hear both Annette and Geoff say is something that really kind of struck me as, isn't it interesting that the best quality healthcare in the long run actually costs less? And it costs less because it means that the issue gets addressed and you don't have revisits and the things that kind of go along with that. So that really kind of struck me as kind of aha. It's that kind of, Annette, I want to kind of ask you, and that is, we've heard a little bit about the complexity of healthcare, and Geoff kind of made some reference to Simple Pay. What is Simple Pay and how is it different than everything else out there?
Yep, so Simple Pay is a self-insured or minimum premium health plan, and it's very unique because the foundation of Simple Pay is the steerage to high quality providers. So as Geoff said, there are many different solutions out there. There's different funding arrangements. You can, stack your deck in your healthcare program and do certain things like reference-based pricing. But if you're not managing the underlying claims, that's low-hanging fruit. Not to mention the fact that this is all going to benefit the employees from a health standpoint because you're getting them to the best quality doctors. And many employees have no idea that they're not going to a good facility. They're not going to a good hospital. We've done some analysis with some of our clients, and some of the most highly used facilities, being used by the employees were not the best ones. So I think there's a lot of education there. As Geoff said, these tools are available, the data is available, but if you don't build it into the plan design, employees are not going to use it. As much as they have good intentions, it's just not going to happen. You're not going to get that engagement with those top quality physicians and facilities unless you put it in the plan design. So Simple Pay is a plan that was developed based on quality. It is a very simple plan design. It's copays only. There's no deductible, so that financial barrier to care is removed with Simple Pay. The copays vary based on the quality of the physicians and the quality of the facilities. So the employee is going to pay more if they choose a tier 3 provider. They're going to pay the least amount if they choose a tier 1 provider. So baked into the plan design is the best way to succeed. It's the best way to drive that engagement. The other thing we love about Simple Pay is the member experience. There's a dedicated health pro, and there's also a member app. So if I need to see a specialist, I can call my health pro. It's the same health pro each time. So it's different than calling, for example, Cigna's customer service, where you could get 1 out of 50 people. But they're going to help find the best quality providers for my specific condition. They can also help schedule appointments with the providers, and they're there to just, help manage me through that episode of care. Also, at the point of service, members pay nothing. So this is completely different. It's a mind shift. It's a paradigm shift from traditional health insurance. There's no deductibles. There's no co-insurance. It's co-pays only, and the members pay nothing to the providers when they go. They receive a simple pay bill, and they can pay that bill online. So it's just completely different, and it's like a more traditional shopping experience where the member knows what they're paying up front before they make that purchase, so to speak. There's also it's basically a single solution. So from an implementation and kind of setup and management perspective, it's a single solution. It's an integrated model. So it takes the best of quality steerage and financial savings paired with an integrated model with the PBM, an optional PBM. There's the concierge medical advocacy, and then there's some lifestyle management solutions that are all baked in. So from an employer and an HR perspective, it's just nice because it's a good package, but it does have the flexibility to add, for example, a centers of excellence. So really it has the flexibility of a large national network, but it's got the concierge medical support. And with that plan design being driven based on quality, the engagement and the savings are, they're great. The employer savings, of course, is the other reason why we love this product. So the savings, without disruption, things like reference-based pricing, the employers are still getting significant savings. 20 to 50%. And again, it's easy and it's seamless for the members with all of that concierge support and none of that balance billing potential.
If I'm hearing you correctly, the employee pays much less, and the implication is the employer pays less. Geoff, am I hearing that correctly?
That's right. And as we talked about earlier, it's somewhat paradoxical at first, but high quality care actually costs less. Just the unit cost alone. And think of it in terms of efficiency. So if there's really nothing in a PPO network to keep me from getting a hip replacement from a doctor that does 2 a year or a doctor that does 85 a year. The doctor that does 85 is better at them. He's doing more of them. He's more efficient. There's less time in the OR, and he subsequently is charging less. And so there's savings on the unit costs. And then, as we discussed with the principle of the Center of Excellence, good doctors also do less. They do less unnecessary testing. They have you in the hospital for fewer days, and they're actually doing surgery less often as well. And then, Mike, as you alluded to, there's less downstream treatment needed when there's a lower readmission rate, a higher success rate, a lower infection rate. And so, again, the key is getting people to actually go, know about these facilities and these providers and actually to go. And, what we've seen in our experience is that you have to have a clear financial incentive to make that happen. And I'm not sure who came up with the idea of the deductible, but it's a pretty bad idea in healthcare because, what we found since ACA is that about 30% of people are deferring necessary and relatively inexpensive care because of the sticker shock of the out-of-pocket. Meanwhile, the people that do happen to hit their deductible, your big spenders, no longer have any incentive to get lower cost care. And so one of the reasons we think this model is so brilliant is because regardless of where you are in the plan year or where you are on your relative to your deductible, at every point of interaction with the healthcare system, you have a choice, and it's directly correlated with cost and quality. And so what Simple Pay has found is that, they're taking that 30% of members that are going to high quality providers, and they're doubling it and tripling it with that transparent incentive design. And the results are pretty phenomenal without any disruption, without much employee education, without having a narrow network and taking away choice. Employers last year on Simple Pay saved between 19 and 51% on their total medical spend.
That's a pretty staggering number, and I'm realizing we're quoting a lot of statistics this morning, a lot of data. And for those who don't deal with benefits on a daily basis, I hope we're not losing you. But what I hope you're hearing is, on the whole, what is it that we're learning about on Bench Builders through Totem is that there's some alternatives out there that, quite frankly, I did not know existed. And as we're working with our clients, we want to make people aware, employers, of kind of what's out there. We've got a couple of questions I want to ask. I want to ask the first one. It came in early, and that is, I'm going to ask this of you first, Geoff. Is it possible to offer health insurance if you're a small employer with, say, less than 10 employees?
Mm-hmm. So to put in, so you have a couple options, and I'm certain, even though this isn't something that we do, we generally work with middle market employers. I'm happy to help you with that. You have a couple options. One is you don't offer insurance and you let people go to the exchange. As of this year, you can actually subsidize that through the ICHRA, which we call the ICHRA. And you can give as little or as much as you want with no penalty, as long as you have less than 50 employees. There are some self-funded, level-funded options for 10 or less, but they do require underwriting on each member. And so that's really only a good option if you have really healthy people. And then you can go to the small group market, and that's challenging. You're looking at 10 to 20% inflation every year, and you don't have much to do. You can't do much. So we're at Totem, we have about 50 employees, about 35 on our medical plan, and we took a big risk this year, going self-funded at our size, and we did it through a captive. But we're really confident in these tools, and we're, without really changing our costs, we were able to say, hey, employees, you used to have a $6,600 deductible, and now it's zero. We think that's pretty powerful. And, as the savings add up over the years, we'll be able to pass that on, in additional benefits as well.
Mm. Geoff, you made reference, Totem is an employer, and you are kind of practicing what you're preaching by adopting what we're describing this morning for your own employees. I want to ask another question, then we're going to move to Rhonda here in a second. Annette, one of the things I'm hearing loud and clear is we're trying to make employees aware that high quality care is not in your best interest. It will cost you less, and in turn, it will cost us less. But there's this question of, how do you know which of the physicians are good and which ones are not so good? This is a question I posed when we were talking before the webinar, and I'm going to pose it again to you here, Annette. How do we know? How do they know which ones are good or not so good?
Right. So the co-founders of Simple Pay have a very unique background. And one of them, Scott Shainvogel, was a co-founder. He's actually a former CEO of Compass Health. And Compass is a national navigation, employee navigation company that was purchased by Alight. And he has over 20 years of experience working with, understanding that the system is fraught with misaligned incentives, and working with data and technology and hospitals and employers to develop algorithms to find the best providers. So it is data driven, and it's down to the very specific procedure. And the other co-founder is also an executive of a national insurance company, and he has extensive hospital background as well. He's an executive of a hospital system. So SimplePay has this proprietary database combined with IBM Watson, a huge data engine. So again, it is algorithms based. We have, millions of algorithms that identify the outcomes, the complications, the reoccurrence, and that's how that's developed. So it's a national network, and it has the flexibility, though, to add physicians in the event the employer would like to do that. But SimplePay is constantly looking at that data and constantly, making certain that the most current data is available, and they're making it more complex and developing, better and better data solutions to be sure that that's accurate.
Annette, both you, I'm going to interrupt you for a moment. Both you and Geoff, you've done a great job of answering the questions that we had of you. Just to remind the folks who are attending the webinar, we would like to continue to hear your questions. What I would like to do is move shortly to Rhonda, and I trust that both you, Annette, and Geoff, you can stay on with us such that when we finish with Rhonda, I'd like to kind of come back to you with some additional questions and some questions that are coming in on the Q&A pane. Does that work for y'all?
Sounds great, Mike.
Yeah.
Good. Rhonda.
Good morning.
I'm getting in the car this weekend and I'm driving around town, and what I'm seeing are people everywhere. I'm seeing people not practicing social distancing. I see people hugging. I see people doing things. And so is it fair to assume that COVID is over?
Well, unfortunately, I don't think it is. We'd all like to think it is, and it might appear it is in many areas that you're out and about or what you see in the media. And what I want to do is just provide some updates on what's happening and what businesses should still be focused on to make sure you're protecting your employees. So in the areas that Mike and I are in, at least, as well as some of the surrounding areas here, COVID cases have increased multifold over the last couple weeks. And I'm in Hamilton County, Tennessee. I know several others are, where I obviously keep track of much more closely. And we've had 3 times as many cases in the last 2 weeks as we had in the first 2 months. And a lot of that is due to more testing. And with businesses and different places opening up, they're testing more people as well. So that's part of it. But as you see, a lot more people have an exposure to a lot more people, it's going to spread more. So as businesses, you just need to be aware as you're reopening and other businesses are reopening, your employees are getting exposed to a lot more people inside and outside of work. So what you want to continue to do is some of those practices we've talked about in previous calls in your workplaces: social distancing, limiting common access areas such as lunchrooms, break rooms, gathering places, conference rooms, meeting rooms. Continue to try to have conference calls or Zoom calls, even if everybody's in the office. Don't get a whole bunch of people together in a room. Even though, some of the government restrictions have been lifted, you still want to be really careful because COVID is not over. It's still here. And we're still, if you follow the numbers, we're still seeing 20,000 cases a day in the United States. So it is obviously being treated and it's stabilizing, but it's not gone. So, continuing to practice those things within your businesses, limit visitor access, limit where visitors go, and most importantly, continue to communicate with your employees about social distancing, about the requirements within your workplace, and look at where your risks might be. I've heard of a few different companies within the last couple weeks that have had a positive COVID case, and they never had one until just last week or the week before. And the other thing to keep in mind, if that does come up, is to make sure as an employer what your responsibilities are as far as notifying people who've been exposed, keeping confidentiality of anybody that does have health issues within your workplace, and knowing what's available to your employees under the CARES Act, the sick leave and the family leave. So we haven't talked about that in a while. It was new, it was confusing. We put a lot of details out, but now companies are having to kind of refresh themselves if they haven't had to deal with that, because COVID cases are coming up and exposure is being increased. So it's not over. I know some people are very anxious just to get back to normal, get life back to normal, and others are still very apprehensive and cautious. And so you're dealing with that in your workplace as well. And you really need to listen to people, listen to their concerns, find out what's going on. You know, on top of COVID, now we have all the protesting, and I'm not going to spend any time on that, but it's just more gathering places where you have multiple people exposed, and it's also raising people's anxieties. So you have a lot to deal with in the workplace right now. And just really make sure you're communicating with people, anything you know, what's going on, what your expectations and standards are, and really listen to them. Something else you can obviously do is continue to work people from home, if that's a possibility, to limit your contact and exposure at work. And maybe even ask people who are willing to come back to work first. If you have people who are apprehensive and you can still continue to telework them, they're going to have a better state of mind if they can do that. But if you have people that want to get back into the workplace and are willing, maybe start bringing them back first if they're more comfortable with it. So again, you know, trying to make your employees feel comfortable as well as protect them and make them as safe as possible at work. You need to really continue a lot of the practices that have been recommended by the CDC and know how to handle those situations if you're faced with a COVID case. And of course, we can always help with that if that comes up. We have a lot of people that will call or email and say, hey, I just had a positive COVID case. What do I need to do? And we have all the materials available that we've sent out before, but we're more than happy to help talk you through that if that happens. So it's not over, and they're already talking about the next wave in the fall, which isn't that far away. So the changes and different things that you're doing now, again, may not be so temporary. We really need to think of this as potentially a mid to long-term solution of the way we're going to do business going forward, and it may not change in the next couple months, unfortunately.
Rhonda, this is our 11th webinar, and the very first webinars were very much in kind of reaction mode. Mm-hmm. What do we do as business owners, business leaders, and HR professionals to react to what's happening and what's happening fast? We've described this as kind of coming in phases. The first phase was kind of like a medical emergency. And we've spent time talking about healthcare and what pressure that might place on healthcare and healthcare cost. Now it seems as if it's transitioned in part to more of an economic emergency and what impact that's going to have. These are all putting pressures on employers. I want to point out something that came up in an early conversation I had with Geoff, probably 6 weeks ago, Geoff, when you and I were talking about what's going on in your world. For those who don't know, Totem provides services to very, very large employers, medium-sized and smaller. But what caught me by surprise, and I was very pleasantly pleased to learn this, is, Geoff, when I asked, what did y'all have to do to scramble to get ready for COVID? Share with the folks, what did y'all have to do? Did y'all have to scramble to adapt to a virtual work environment?
No, not really. You know, I would say maybe 5 or 6 years ago, really started thinking hard about what we call a disaster recovery plan, because we do serve customers and employees across the country. And if there's an ice storm in Georgia, or a AT&T cuts our internet,
that would never happen, would it?
Only about once a quarter. So no one, our clients don't really care, and they shouldn't, right? And so we, you know, all our technology and our call centers in the cloud, voice over IP. which is phenomenal because people can go home quickly. And so as part of that strategy, every employee has a relatively inexpensive laptop and headset at home. And we can quickly, scale that. We really only had to purchase a couple extra laptops and we were ready to go. And so we were blessed to have had that figured out ahead of time. And, Annette and I are in the office today, but we generally don't come in the office. And we, out of 50 employees, we really only have one or two that are required to be in the office because we're sending out legally mandated paperwork for FMLA and things like that.
Well, we've had clients who came fast and furious asking for our help. How in the world can we quickly transition to a virtual work situation? And what I'm hearing y'all say is that y'all anticipated that years ago. You had a plan in place. And so when you had to actually push the button, it was almost a non-event. It was a non-event for your employees. It was a non-event for your clients. And a lot of organizations can't actually say that. They're still adapting. Rhonda, I want to come back to you for a moment. I'm listening to you talk about how important it is that employers stay vigilant. But don't we risk kind of sounding like Chicken Little? We keep talking about how fast the cases are growing in certain parts of the country. We keep talking about taking precautions. How do we avoid, as employers, getting a bit dismissed as being overly reacting to this?
Well, I think you need to find a balance in how you communicate with employees. You certainly need to share facts with them, but you need to find ways to look at it positively too. We want to keep them safe, so you can't hide information from them just to try to make things sound better and try to paint a pretty picture. So you need to be very honest and factual with employees so that they're aware of what's going on. But more importantly, what you really need to communicate with employees about is what's happening in your business. So what to expect, what you're doing to try to protect them, what your cleaning procedures are, what the expectation is as far as social distancing. So what employees really want to hear is that their company cares about them and they're putting things in place to make sure they're safe and make sure they're healthy. And also to take a look at what your employee situations are. So, we come back always to communication and listening to your employees and finding out what their concerns are. If you have that good relationship with your people, they're going to come to you or they're going to talk to you or you're going to know what's going on and be able to address it before it gets to an escalation point or before somebody gets extremely stressed or anxious over something that maybe you can have an impact on just by working with them. So I would say it's tough. And if you watch the news and listen to the media, the sky is falling. That's all that's in the media. So, the more that you can do to kind of balance that with your employees and really focus on what your business is doing to pivot, to make sure that they're safe, but to also make sure that the business is strong and moving forward. A lot of businesses have been negatively impacted through this, and that's really tough if you have to try to find something positive to communicate to employees. But you need to try to keep their morale up, keep them engaged. If you need them there to work, you've got to keep them engaged in something positive. So as hard as it might be to find something positive, you got to find it, and you might have to even create it. Do something fun for employees at work. Do something extra for those people that have really put forth an effort. But you have to find a way to balance that as an employer and factual, but find something positive to be able to communicate to people on a daily basis, if possible, to keep them engaged.
Got you. Hey, Annette, I want to go to you for a moment. We had someone who joined the webinar a few minutes after we got started, and this person wasn't real familiar with this notion of centers of excellence. And y'all have tried to explain that. But I want to come back to the question of finding a physician. And that is, oftentimes that's a one-on-one relationship, but my goodness, how do you go about picking a physician. How does, and in the plan that you've described, how do employees go about finding the best doctors?
So it's very easy. They have a mobile app, and there's basically a green, a yellow, and a red indicator next to different providers. The green has the lowest copay. That's the top quality. That would be tier 1. The yellow would be the mid-level, and then the red would be the highest copay goes to the red, because we're incenting employees to choose those tier 1 providers. It's super easy. It's super quick. So many people love checking the app and doing that. It's all right there at your fingertips. But again, there is also a concierge, telephonic concierge, that can do that in the event someone does not want to use the app.
So let me see if I heard this right. What the employee who has the app, it may literally be on their phone. They're looking at the app, and what this app is going to do is indicate through colors, green, yellow, and red, which of these physician choices are not only the best, but would cost you the least. Am I hearing that correctly?
That's right. So it's color coded, and the actual copay of what the member will see is right there as well. So they're going to see, for example, as Geoff said earlier, with this plan, there's no deductible. But if a member had an outpatient surgery, tier 3 copay could be $600 as an example, and tier 1 could be $200. So it's going to say, $200 green, $400 yellow, and then a $600 copay for red. So it's just super easy, super quick for the members to have that at their fingertips. It also shows some additional data, like readmission rates. There's a few other pieces. If they dig deeper, they can see that on their phone as well.
Rhonda, I'm going to go back to you for a moment. As someone who not long ago was managing a complex benefit plans for an employer, do you find that the typical employee is just overwhelmed by all the stuff that has to take place in making healthcare choices?
Well, of course, and many cases, obviously, employers offer a plan, and that's the plan that the employees have available to them. And I think Annette and Geoff know better than I do, but a lot of the plans have opened up more in terms of their provider network. But several years ago, it was so limited that you had to use a specific network, and if the doctor you wanted to use wasn't in that network, then you paid more, or you had to select a different doctor that maybe you didn't like or want. So I've dealt with constant issues within the workplace of not being able to go to the providers you want, or ending up with bills that, like you were explaining, Annette, you get bills in the mail, you don't know what they're for, you were told you didn't have to pay this. So yeah, it is a constant nagging headache for everybody actually with health insurance. And I've always kind of made the joke, even with my own, I feel like I'm always having to chase down my money. You have to follow up on everything. And for people that don't have a lot of background or don't know or understand some of the ins and outs of it, you have a lot of people that are probably paying money that they shouldn't be paying, but they don't know any better to question it or to look into it or to look for alternatives. So it's a constant headache for people to have to deal with health insurance. And I do actually have a question kind of related to that, Annette. So with the Centers of Excellence, is that a health insurance plan, or are there different health insurance companies that you can, an employer or a company could have and utilize the Centers of Excellence?
Sure. So the best results for the Centers of Excellence programs are these special Centers of Excellence vendors. There's a few of them across the country, and they basically go out and they contract with these facilities across the country, and they develop bundled pricing for procedures as well. So the biggest thing with these designated Centers of Excellence is that the physicians are on a panel. So they work as a team and they're paid salary. They're not paid, fee for service. It's a salary model. It's truly quality based. So that's, one of the largest differences with these Centers of Excellence. The members don't pay anything at the time of service. They are, basically all travel expenses are paid for by the plan, but the discounts, the bundled pricing is so significantly less expensive. An orthopedic surgery might be $70,000, but at a center of excellence, it's going to be in the $25,000 range, or, much lower even. So, it really is a great benefit. But again, it gets back to this, the doctors are paid by salary, so they're not incented to do more surgeries. So there's the vendors that offer this. There's a few vendors across the country that offer this. Most of the large insurance companies have a Centers of Excellence program, but the results are not the same because it's more generic. They're identifying all these good facilities across the country, but they're not going down to the very specific procedure level and saying, Mayo Clinic is the best for this type of cancer, for this, for this treatment plan. Geoff, do you have anything to add?
Yeah, I would. The vendor that we use is called Edison, and we're actually doing a webinar with them in about 3 weeks. If anyone is interested in this in more detail, they don't even call themselves a Center of Excellence program anymore. They call themselves Smart Care Centers because the term has been really kind of abused, I would say. For example, the Anthem Blue Cross Center of Excellence program generally has worse outcomes than their regular PPO providers. So something's missing there because it's not about quality, it's really about cost and volume. And so like a Blue Cross will not let you put in an Edison Center of Excellence program. It's a non-starter, but an Aetna will. And so there's some flexibility there with the larger carriers. Generally, Aetna is the most flexible. United has some flexibility. And then when you get to a Blue, it's really kind of their way or the highway. So that's something to consider if you do have high cost claimants, which we all know generally drives the overall cost. The 5 or 10% that have chronic musculoskeletal joint replacement, back surgery, organ transplant, cardiac issues, things like that. So if that's a component of your population, we find that that's a really good Center of Excellence program to be kind of a slam dunk in terms of not only getting those folks better quality care, but saving money too.
Just one really quick thing to add there. I think the biggest benefit of a Centers of Excellence program is that you're allowing your employees to go somewhere where they never would have had access to. For example, if I need to go to Houston for a heart surgery and it's covered under my plan and it's no cost, my employer is helping me find this provider, and I never would have gone to Houston for that surgery. So I think just the ability to provide that higher quality care is, definitely most important in my mind.
One of the things we've learned by hosting these webinars over the last now almost 3 months is there are a lot of smart people out there with some really creative ideas, and we have benefited greatly, we bench builders, by learning from experts such as you, Annette, and you, Geoff. You're opening our eyes to some things that we may not have known even exist. What we're hearing from the participants is that they like what we're doing. They have asked us to continue doing that. And I can't believe we're about out of time. I want to thank both you and Annette for joining us and giving us something that, for at least me, I had not heard of. And you're introducing us to a kind of an out-of-the-box solution that I just did not know existed. And I hope that has been a benefit to the folks who have kind of tuned into our webinar this morning. Let me just mention to you, the format we have followed is this has been on a kind of a weekly format, and we've already lined up next week's panelist. And what we've done is we've asked bankers Sam Turnipseed to join us. As I've gotten to know Sam, he's really not the typical banker. And I think what he's going to do for us is give us kind of a fresh perspective. Yes, he will update us on PPP. He will update us on other related matters. But what he will be doing is trying to stress that at all times, when we're dealing with our customers, not just external customers, but our internal customers, For HR, that's our employees. For leaders, that's for the folks who work for us. For businesses that have outside customers, we have to be ever mindful of what are their needs and what are we doing to adapt to their needs. And in today's highly competitive, uncertain environment, we've got to be willing to do things differently. And I want to say thanks to both Annette and Geoff for introducing us to healthcare for self-employed companies done differently. So thank you both, Annette, and for you, Geoff, for being with us this morning.
Thanks, Mike. Glad to have been able to join.
Thanks, Mike. Thanks,
You
Rhonda.
bet. Rhonda, as I've kind of have found, this has become, you've done an excellent job of trying to keep us current on a number of things, but probably more of a kind of an emphasis on the HR side. What I would also remind those who are joining us, if you have questions that you would like asked of Rhonda or of me that we did not get to in our time together, we would like to be available to you. So in the email follow-up, there'll be a link. If you would like one-on-one time with Rhonda or me, we're going to be happy to do just that. We're going to be in a position to hopefully answer questions that might be a bit too detailed for the setting we're in right now, or it might be a question that you have that's a bit too sensitive to ask in a public setting like this. I've listed here, if you would like to reach out to either Annette or Geoff, here's their contact information. I know they would love to hear from you. So if I might, I can't believe we're out of time, but on behalf of Rhonda and I in Bench Builders, I want to thank Annette and Geoff for joining us this week and encourage you, if there's been value to you this week, we hope you will join us again next week. That being said, I wish everybody all the best. Go out, be safe, stay informed. Thanks, everybody.